Good afternoon and welcome to A Place Called Through. We're broadcasting today live from WYTV7 Christian Broadcasters Network. We're a nonprofit network where we share stories at a place called through of life stories, life journeys, the hardships, the trials, the tribulations, the devastation that's often felt by many, sometimes different for others. But we also share a mission of hope where there is peace, joy, and love and happiness. We share these stories, and it's all made possible through your charitable donations. Can I count on you today to make your donation to our mission of hope? I thank you in advance. Today, we are so honored to have with us on a place called through Miss Yahara Bennett, who is representing a group that's located in South Carolina of the Low Country that works with the Latino population. Miss Yahara Bennett will talk to us about some of the challenges that they face, what resources are available, and how the organization has been formed and helping those in the Low Country. I welcome you, Ms. Yahara, today to A Place Called Through.
Thank you so very much, Pat. I'm very honored and glad to be here.
Ms. Yahara, for our listeners and our viewers, would you pronounce your name for us and give us who Pesos is? Tell us about Pesos.
Sure. My name is Yahaira, and I have two last names, Bene Uzcategui. And I'm a community health worker for Pasos. And Pasos is a community-based statewide organization that I like to call Made in South Carolina, that originated to respond the needs of the growing Latino community that started arriving to South Carolina around year 2000. Julie Smithwick is the founder of Pasos, which originated in 2005. And like I was saying, it was as a response to the Latino community that came into the area that were not accessing services, did not know where to go for services, even for medical care. So she found those needs. And at the same token, agencies and organizations also found that they were not prepared and they did not have the capacity to work with the Latino community, being that it was new, they didn't have materials translated into Spanish, and even in the case that someone that spoke Spanish called the agency, they did not have any bilingual staff able to come and respond. So that's a little bit, how Pasos started here in South Carolina.
Is PASOS an abbreviation for something, or is that organizational name PASOS?
Well, originally PASOS standard for Perinatal Awareness for Successful Outcomes, but around 2012, because, and you and I know each other for a long time, and you remember that at the beginning, I was working basically with women that were pregnant. And we were offering workshops. And again, that's how I got in touch with you. That's how we met. Yeah. You offer your doors, the Jasper County Hunger Free Zone, to come and offer workshops while you were distributing food. So it was really a neat experience. But of course, those children were born, and as they are born, there's other needs and other questions and other necessities that families have. So then Pasos actually evolved, and right now we stand just as Pasos, which in Spanish means steps.
Okay, and it's, as you say, back in the day when we first met, I know that you were dealing with, the pregnancy, the moms and the pregnancies. Has that population increased by, I guess, how many percent of it has increased in Jasper County or in South Carolina in your servicing area? What is the margin now that you're seeing? Because I know that we still see them still through, the food program, but they're at minimum. And so would that be the minimum being that the barrier in the language or the insecurities?
Well, the Latino population in South Carolina really, I think we are the fourth fastest growing in the whole of the nation. So I think in the last that I heard it was about 400% of growth in South Carolina. I remember that before we used to say that in Jasper County, children under 5 of Latino origin, we're about a 26% of the population. But I think that is shifting and is going to grow, because I also know that, I'm the coordinator of PASOS in Beaufort and Jasper counties, and I know that there's a lot of families that are moving into Jasper County. So I think that Jasper is going to see an increase of Latinos coming into the county.
And
Um,
for our listeners, let's clarify that Beaufort County, Beaufort is Beaufort, South Carolina, and Jasper is considered as Ridgeland, South Carolina.
mhm. Yes, and like I was saying, you were mentioning the barriers or the difficulties, and probably language is one of them. Sometimes not knowing, that the food bank is there, and actually, when you send information, we make sure that we share that information in our local Facebook page to make sure that families know that there are services available for families.
So are you finding challenges with, I guess, the collaboration with other organizations that would support your mission? Because we know in some of the counties in the local areas in the low country, there's just not a lot of resources available. So what are some of the challenges that you're facing with trying to network with some of the organizations to help support your mission?
Well, actually, I have to admit that in my case, it has not been the case. Truthfully, I think particularly in Beaufort County, there's a lot of collaboration, and it's the same in Jasper County. That's what I found. I found that people, because they realize and they see the need to access the Latino community, truthfully, they reach out to us because, like I said, PASOS is the only organization in South Carolina that is focused their work in the Latino community. So actually, we're working very close with South Carolina DHEC. We're working very close with DHHS, which is the Department of Health and Human Services. So we really are working close with a lot of organizations, again, because being the only agency that is just completely focused on the Latino community, we have that recognition, and we come with the trust of the community also. Because we've been here and we've been doing this work for such a long time, the community really knows us and trust that the services and the agencies that we connect are going to be, they want to work with them. And actually, it's funny because when you have shared information and I posted it, I had messages back saying, thank you so very much for giving me that information. So, I mean, there's a very close relationship that we have both with agencies and also with the community. And so I really haven't found a lot of difficulty. The thing is, we have a lot of families that are that have moved to the area recently. They haven't been here for a long time. Also, a lot of the individuals that come here, they may be isolated. They may not know other people. And because we're working with first generation of Latinos, coming directly from other countries, learning the system, knowing what services they can access. Sometimes I've heard individuals saying, oh, I didn't know that, I was able to receive these services. And I said, why wouldn't you not? But, perhaps where they come from, there's not the availability, the disposition of so many agencies to really work with the community.
And then would the language itself be present a barrier for some?
Of course, language is a big barrier. I always tell everyone, I said, look, I'm not smarter than anybody else. I'm doing this job because I speak both languages. And really, it's the ability to speak the language. It gives you such a freedom. And I remember actually when I arrived here when I just arrived at the beginning, I had studied English for years, but I've never spoken to anybody. And I remember when I came to the States feeling like a kid again. And that was a weird feeling because, I was in my early 20s and kind of regressing because you are learning so many new things. The way of life is so different here. Not better nor worse, it's just so different that, you kind of regress a little bit. So yes, language is a big issue. Transportation, that we live in a rural area. and we don't have as much public transportation like perhaps in a city. So that's an issue also, getting to go to the places where the services are provided.
Yes, and I can imagine transportation because I know that in the low country there is no public transportation. I
Mhm.
know that certain agencies, they do provide like medical transportation, but if they're in need of transportation to go to, for instance, Department of Social Services or even Department of Motor Vehicles, in case they are blessed to be getting a vehicle, are there any supports that your agency can offer them or do offer them in situations like that if they have an appointment, maybe even for a job interview? How does transportation come in for that?
Well, actually, we don't provide transportation. So really, that's a humongous barrier that we have here in the area. What we do, really, the role, I don't know if I mentioned, but I am a community health worker, and many people will say, well, what is that? A community health worker is a person from the community that is cultural, and speaks the language. And even though I cannot say I know all of the different countries, I mean, Latinos, we are from many different places. And the same token, we share some commonalities like his language and, some of the aspects of the culture. So the way I see myself is more as a connector, and we connect them to services. But unfortunately, like you mentioned, with transportation is a big issue, and we don't have it. We just don't have services that provide transportation for people to go to services as important as, DSS, a job interview, things like that. I know that in the community, what is happening is there's a lot of people that offer transportation, and of course it does their work, so they do it for a price. But that can be costly also. I know that sometimes to come to the health center where I have my office, people pay $30 or more to be able to come and be seen by a doctor.
That's amazing. Well, we're going to prepare for our station break, and I want our viewers and our listeners to stay in tune, and we'll be back with Ms. Urahara talking to us more about the effects of pesos and the effects it has on the Latino community here in the Low Country. We'll be back shortly.
Hola, ¿qué tal? Les habla Yajaira Benet Uzcategui. Soy promotora de pasos. Mi teléfono es el 843-476-6189. Si tiene alguna necesidad o preguntas, no dude en llamarme. De nuevo el teléfono 843-476-6189. Hi, my name is Yajaira Benet Uzcategui. I am a community health worker with Pasos. I work with the Latino community. If you have a friend or someone you know that does not speak English, speaks Spanish, and has some needs or questions, please tell them about us. And they can call 843-476-6189. Again, my phone number, 843-476-6189. Gracias.
And we're back with Ms. Yohara Bennett, and we're discussing today Latino population and her nonprofit organization, PESOS, and the support and the efforts that are being made throughout the Low Country. We welcome you back to a place called Through with me, Ms. Yohara Bennett. Ms. Bennett, we were previously discussing transportation and the barriers and the language barrier for the Latina population and the lack of support sometimes that we can't find because of the area that we're in. We have limited resources, so we were kind of talking about some of the resources that are available and some of the resources that are not available and how they hinder the efforts of PESO. So we want to go ahead and kind of finish up where we were talking about the transportation, because that is a major issue here in the Low Country because there is no public transportation. So a lot of, not just the Latinos, many people, and particularly even with seniors, have difficulty to try to get from one place to another. As you indicated previously in our discussion, that people may come to your office even and looking for transportation, and if they're blessed in that area, that they are being charged fees. How much of a fee are we actually seeing here that people are actually charging to transport?
Well, like I said, I'm hearing about 30 coming from, let's say, Hardyville, Richland, or Bluffton to one of the facilities where I work, which is Chelsea. But I mean, there's probably other fees if people come from farther away. And talking about also the public transportation, we are, that's one of the things when I came to the States, distances are large. We are not small communities. Like if you are in a city, I understand that transportation is perhaps easier to deal with, but how to determine, and I think it probably can be done to have some routes where people, could pick up a bus and come to a health center or go to DSS, for example, the Department of Social Services. The thing, what I see is that we live in a rural area and it's not so easy because if I live in the center of the town, then I'm okay, I'll be able to pick up a bus. But how about if I live in the outskirts of town? And that's the reality that we have here. So I think that's a barrier that I really don't know how we could solve. Sometimes I've been thinking about perhaps circles that do certain rounds and connect, but still that is not going to really affect everybody. And a lot of the people have their own transportation also, and transportation here is not a luxury, it's a need.
So now that we're in a statewide, nationwide pandemic, COVID-19, how has this affected any of the services, the programs, the Latino population as a whole?
Well, actually, in a recent article in the Island Packet by Sam Ogolasek, he mentioned that actually in Beaufort County, those cases of individuals that were declared as ethnicity Latino were being highly affected by the COVID. And I think he was talking of numbers of 19% of those that consider themselves Latinos or they reported themselves as Latinos were being affected by COVID. And that taking into account that in 2019, Latinos in Beaufort County were about at 11% of the population. So the Latino population has been affected in an important way here in Beaufort County, particularly. I think it's about 10% all through the state. So that means that, of course, families have been affected in many ways, particularly because they haven't also been having access to some of the stimulus checks and some of those benefits that perhaps other people have received that has helped a little bit to help a little bit the toughness of the situation. I know that in regards to communicating information about COVID, DHEC, CDC, they really have been very good at informing in many languages. Among one is Spanish. So the information that is coming through by CDC and DHEC has been in Spanish and has been available. And I like that they use a lot of info charts, a lot of graphics, not too many letters. And that is a way to make really the information accessible for people. Also, Pasos has, we have a Facebook page. And because of COVID, I mean, COVID, it to me is kind of weird because COVID is something that is being a stop for a lot of things, but at the same token is promoting a lot of things. And so now, for example, with Pasos, we have been doing a lot of Facebook Lives that we are sharing with everyone. We have been doing a lot of short, brief information over the internet. We're doing radio now. So really, it has forced us perhaps to move a little bit more because we cannot do outreach events. We cannot go into the community to, offer services or show here we are, we can help you. So we've been taking a more active role in social media. So also, for example, in our case, we two of the community health workers that work with you for Jasper Hampton Comprehensive Health Services, before we have to closed because actually the agency closed some of the sites to kind of concentrate the efforts and be able to remain open, which we have done, and I'm very proud and happy about that. It meant that we were not going to be able to see people face to face. So we had to think of ways how can we continue helping and offering services. So for example, now we help with to the Medicaid applications, because while the patient is in the clinic at the health center, they sign the form and then we do it over the phone. And DHHS has been very, have received those applications with no problem because we cannot see them face to face. So really it's making us think of different ways. But yes, it's caused a lot of issues in the Latino community because, unfortunately, and I think that's the reason why so many people in the Latino community have been affected, there's multiple families living in the same address, at the same home. So, when you are living with several families in the same home, the probability of, becoming ill is higher. On the same token, because of not having stimulus checks or other benefits, financial benefits, of course, they have to go to work because otherwise, they can lose their job for one part, but on the same token, if they don't work, and many people have lost their jobs, how are they going to pay rent and food? So it's really has affected the immigrant Latino community very hard.
And in light of that fact, you mentioned about, the family unit and someone, if they're fortunate to have a job, they do have to still go to work. The effects of COVID-19, I guess, as a whole on the family unit, I'm sure there's even more challenges there because if someone should be affected with COVID, that means that that person that's the head of the house, I assume, that is working, they're no longer to go to work. So what kind of resources then would you provide, or do PASOs provide for individuals or families in those situations?
Mm-hmm. Well, some of the things that PASOS has been doing, and this is happening all through the state, is, for example, we have some of the community health workers that go to the homes and perhaps they have connections with food pantries and they deliver food items to them directly to the homes. So also I know that there's organizations like SC Thrive, that they have a rental assistant program and they have translated all the information in Spanish. So actually, again, like I said, I see myself as a plug. We connect them and they have bilingual personnel, staff that can help them apply for rental assistance, for example. I also, PASOS has been collaborating with other agencies and organizations like the South Carolina Minority Affairs Commission, Appleseed Legal Justice Center, and working together and pulling together resources. And they have actually created a website, which is www.recursos.com, where it's all in Spanish and individuals can go and look for different resources because PASOS per se don't have the finances to provide resources. So really what we do is connect families and individuals with the agencies and the services that are out there working with the community. So that's basically the way that we are kind of guiding and directing families with specific needs to those specific services that they need, they require.
And one of the things that we're so honored that WYTV7 also has support programs in place where we're doing feeding families, and also we're offering e-gift cards out where individuals will be able to buy, necessities that they need in light of this COVID-19. So there are other resources out there, and we just need to make sure that our listeners and our viewers are aware that help is available. Can you share with us any of the websites or phone numbers that people in the area can reach out to you for if they're in need of help?
Sure. Our website, and that's for the whole of the state, is www.scpasos.org. and that's our main website. And then if they live in the low country, if you go into the website, you'll be able to see that we are in different areas and all of our contact information is there. But for example, for the low country, I can share my contact information, which is 843-476-6189. And there they can call me, leave a message if I'm not available, and I definitely always respond, and we can connect them. And one thing that I like that you were saying also is how the churches really have come up and brought a lot of assistance and a lot of help. And we want to say thank you. Thank you, because they really have really pulled together. And we have a lot of agencies. You are right. I know that, for example, in Bluffton Self-Help is also doing drive-through food banks, and Deep Well in Hilton Head Island, the Jasper County Hunger Free Zone. So there's a lot of agencies and organizations and churches that are coming together and really providing what people need. And that's why, again, thank you for allowing me to share my contact information, because that's a way that people can connect to me, and then I can direct them to those agencies.
Well, Ms. Yohara, we're about to wrap up. It looks like we're almost out of time, but I most certainly thank you for sharing your information today and being our guest on A Place Called Through. And we want our listeners and viewers, go to WYTV7.org and find out about our Feeding Families and our e-card program, which helps people, in need. People have needs for food, all kinds of situations in this COVID pandemic. And, without the help of each other, we just don't know how we'll make it. So we have to depend on each other, rely on each other. And that's what we're here for at WYTV7, where we share our mission of hope, a place called through, a place where there's hope, there's love, there's peace, there is joy, there is hope for tomorrow, where we share your petition, your praise, and your purpose according to the will of God. We invite you to make your donation today to WYTV7.org. And if you would, we sure will appreciate it to help us continue in our mission. Again, it's been my pleasure, Ms. Yohara Bennett, to have you as my guest on A Place Called Through, and we look forward to you coming back, hopefully another day to share more with us. Thank you so much.
Thank you, Pat, and thank you to the broadcast radio to invite me.
If you'd like to be my guest on A Place Called Through, you may reach me at area code of 843-608-9744 or by email at pgoingswp@gmail.com. You may also follow me on Facebook at A Place Called Through at Willpower, the call to rise above. Willpower, your call to rise above.